I went to Medical College, Virginia, which is in Richmond, Virginia. And back in the early 70s, there was a pretty significant pharmaceutical company called A. Robbins that was right in Richmond. And one of the highlights of going to pharmacy school was you got to tour the facility. And it just was kind of overwhelming seeing the research people that they had there and the things they were working on. But back in those days, they were looking for cures for disease. And now that if you fast forward 30 years later, Robbins has been bought out by Wyeth and Big Pharma. And now to work for a major pharmaceutical company, your area of research is not directed toward cures. They're looking for customers. They want a drug that will manage your condition for the rest of your life. And that kind of a lot of my colleagues in pharmacy and in medicine, it kind of is disturbing that we're not looking for cures. We're just looking for customers. And we try to manage diseases instead of trying to eliminate them. And that's been a significant part of my journey because, I went to OFM because I wanted to manage metabolic syndrome. I wanted to cure it. And from Dr. Mark Cuccizella's seminar, the only proven treatment that will eliminate metabolic syndrome is an OFM approach. And I'm living proof that 18 months later, I've completely eliminated metabolic syndrome. So I just wanted to throw that in about Big Pharma.
There's a lot of good drugs and therapies that have been developed, but you've got to use them prudently because almost all of them, unless they're natural, there's usually unintended consequences, right?
Yeah, and the more that we use them, the more we learn. I think about my dad who lived to be 93, and he was the first male Hughes to ever make it out of his 60s. And there were medications that had a huge impact on him. Number one was a statin. But now we're finding out that there's also some problems with the statins and some of the metabolic changes they have. I'll talk a little bit about my heart attack and my conversation I had with the cardiologist. So 2 days after Ironman Blue Ridge, Virginia, which was a terrible race for me, and hindsight's always crystal clear. So I figured out why afterwards, but I had a heart attack. Now, fortunately, being a pharmacist and every year I have to recertify, I know the signs of a heart attack by heart. And the thing that was hugely significant in me having a complete, and I mean 100% complete recovery, is how fast I got treatment. When the signs started, I told my daughter, take me to the hospital because in the time it would take the squad to get here, we could already be there. And within an hour of symptoms starting, I was in the cath lab getting things fixed. So, but the conversation I had I know the doc was going to put me on a whole bunch of drugs. And I had to have you, okay, look, doc, you got to explain me why we're doing this. Well, the first thing he says, I'm going to put you on a statin. And he smiled and he says, but not for cholesterol. He said, because there is scientific proof that in the first several hours and days after a myocardic event, the statin neutralizes some cytokines that are
for inflammation reduction under those.
Inflammation thing.
Yep.
But I told him, I said, look, I don't want to be on this forever. I have spent, 4 years now changing my particle size of my cholesterol from the small particle to large particle. And a lot of the statins dominantly lower your the large particle size. If you want, I can do a quick run on Dr. Cuccizella's explanation is he used to talk about BBs and cotton balls. And at his seminar, he said, "I'll ask you two questions. If we took a plastic pipe and we ran BBs through it under pressure, how many hours would it take to shred the pipe?" So question number two, same pipe, same pressure. If we run cotton balls through that pipe, how many years will it take to shred the inside of the pipe? Well, with your cholesterol, you have BBs and you have cotton balls, whether it's your LDL or your HDL. And your goal is if you can change half your BBs into cotton balls, they can't shred the inside of your pipe, meaning the inside of your vessels. So through OFM and really my training and watching what I ate and staying away from the carbs, I changed my LDL cholesterol to 75% cotton balls or 75% large particle size. On the HDL, I changed it to 50-50. Well, with the statins, and depending on which statin the doctor chooses, the degree of change can be significant, but they predominantly lower your cotton balls. So if you have a high HDL and we knock, in my case where I'm 75%, if you knock down my LDL, but I'm lowering my cotton balls, you actually made me worse. And the same with the HDL. So
well, and then there's a whole host of side effects of long-term statin.
Yeah. I mean, the brain has to have cholesterol to function. So, you can't take it down too low. So, we agreed on the statin that I would only take it in that period where the neutralizing the cytokines and reducing inflammation. So I took it for 3 months.
I think statins are overprescribed because there's other things you can do to get your metabolism working right, so you don't have the cholesterol problem. But if you're at imminent risk of a heart attack or just had a heart attack, like in your situation, you take a statin because it will save your life.
Right.
And the risk reward for short-term use of a statin is life-saving, right? It's right, that balance, but long term, not so much.
Yeah, absolutely. And even now there's some new protocols, like they tell you if you think you're having a heart attack, chew up an aspirin. Now they're saying, and if you have a statin around the house, chew that up with it, because in those beginning hours it can be huge to your survival.
That's right.
But you don't need to be on them for 30 years. Fortunately, sent me a very interesting study done in Japan of over 2,000 participants using a compound called natokinase. Now, the nice thing about the one thing that is no room for argument is natokinase is a blood thinner.
I actually call it a blood viscosity regulator.
Right.
Because
which is a better term.
Yeah, it's much more subtle than, say, the pharmaceutical blood thinners, because like Coumadin, warfarin, it's thin your blood. That's what it does.
Yeah. Well, interesting. So after a heart attack, everybody will be put on Plavix or clopidogrel. And the mechanism of action of natokinase is very similar to clopidogrel.
Oh, that's interesting.
Yeah. So the cardiologist right off when we started. And the one thing that I wanted to match the dose in the study you showed me.
Yep.
Because
that was
very low.
That was a 12,000 FU dose, right? Which is quite a...
Yeah, it works out to 594 milligrams.
Yep.
So I duplicated that dose. So I was able to stop the clopidogrel. And on the dose, that higher dose is the one that gives you the positive changes in your cholesterol. And what interests the cardiologist significantly is not only did it raise the HDL, but it raised the large particle size, the cotton balls of the HDL. And he said with him, he's not used to working with athletes. Most of his patients walking to the bathroom is exercise. And he says, I have a huge challenge getting their HDL up. So if nattokinase can do what this study says it'll do, he says, I got about a dozen patients right now that I'm going to put it on. And
well, good for your doctor, because that's going against the narrative and the business model, right? Because there's no money in nattokinase.
Well, I found out when he agreed to allow me to do this 40-miler that his brother is a big-time ultra guy who does 100-mile races and multi-day races. So I guess he's more used to dealing with crazy people that come to him with some alternative therapies. The one thing I was impressed is how much better I felt after starting the nattokinase and then the serapeptase, by neutralizing those spike proteins and getting all that junk and inflammation out of my system.
Yep.
I just felt so much better. And, again, hindsight looking back with a partial blockage, the reason I was tired is I wasn't getting enough oxygen and blood pumped out to the places it needed to go.
So your doctor said you've made a complete recovery.
100%. So I had an initial echocardiogram that showed what the cardiologist said. It's like a bruising of the heart. He said if somebody hits you really hard in the shoulder, it doesn't totally damage your shoulder. It just has a nice bruise, and eventually the bruise will go away. In your instances, your heart was significantly bruised. And then when we did the repeat after, taking all his drugs and then starting the nattokinase, when we did the repeat echocardiogram, everything was 100% back to normal. He said, I'm not going to say you're good. He says, it's excellent, your recovery.
Had you ever seen that kind of level of recovery before?
He said rarely. I mean, I kept telling him, you got to treat me like I'm a 56-year-old guy, not a 71-year-old guy. And he said, well, the changes are even better than 56 that you've had with that echocardiogram. And he said, I listened to your heart. He says, it sounds perfect. He says, there's no murmurs. There's nothing that leads me to believe that you haven't had a absolute 100% full recovery. And, the scary thing is, had I not gone OFM several years ago, I probably wouldn't be here with having this conversation. I would have been one of the Hughes statistics that hardly made it out of their 60s.